The history of medicine is filled with brilliant discoveries and life-saving breakthroughs. Yet for most of human history, doctors worked without modern biology, microscopes, or a clear understanding of infection. From drilling holes in the skull to prescribing poisonous metals, these practices reveal a time when the difference between treatment and harm was often uncertain. Here are 8 of the most unusual medical treatments that were once widely used throughout history. One of the most common treatments for nearly 2,000 years was bloodletting. The practice was based on medical theories developed by the ancient physician Hippocrates and later expanded by Galen. According to their model, the human body was governed by 4 fluids, or humors: blood, phlegm, black bile, and yellow bile. When these fluids became unbalanced, illness appeared. Doctors believed that removing blood could restore balance and allow the body to heal. Physicians opened veins with small blades called lancets, or applied leeches to slowly drain blood over time. In some cases, a patient could lose a surprisingly large amount of blood during a single treatment. Bloodletting was prescribed for fevers, headaches, infections, and even serious diseases such as the plague. Unfortunately, many already weak patients became even weaker after the procedure. Another treatment involved the use of mercury, a highly toxic metal that nevertheless played a major role in historical medicine. During the early modern period, mercury became one of the main treatments for syphilis. Doctors believed the metal could purge the infection from the body. Patients were sometimes given mercury ointments that were rubbed into the skin for hours, placed inside special heated chambers to inhale mercury vapors, or even given mercury pills. The treatment often caused severe side effects, including intense sweating, bleeding gums, loose teeth, and neurological damage. Despite these dangers, it remained one of the most widely used treatments for centuries. One of the oldest known surgical practices is trepanation. This procedure involved drilling, scraping, or cutting a hole into the human skull. Archaeological evidence shows that the operation existed as early as the Stone Age, making it one of the earliest forms of surgery ever practiced. The procedure, known as trepanation, was believed to relieve pressure inside the head, treat seizures, cure headaches, or release harmful spirits thought to cause mental illness. Early surgeons used sharp stone tools and later metal instruments to slowly cut through the bone. While the operation was extremely dangerous, skulls discovered by archaeologists often show signs of healing around the hole, suggesting that some patients actually survived the procedure. In early modern Europe, another unusual remedy involved consuming powdered remains of ancient mummies. Physicians believed that a substance known as mumia contained powerful healing properties. The powder was created by grinding preserved bodies taken from ancient Egyptian tombs and mixing the substance into medicines or drinks. Doctors prescribed it for internal bleeding, stomach pain, bruises, and even epilepsy. Because the treatment became popular in the 16th and 17th centuries, a large trade developed in fragments of ancient remains. Some merchants even sold fake mummy powder made from ordinary corpses. At the time, however, the remedy was considered both respectable and effective. Not all historical treatments involved swallowing strange substances. In the 18th century, doctors experimented with a method intended to revive people who had drowned or lost consciousness. The treatment, called a tobacco smoke enema, involved inserting a tube into the body and pumping smoke from burning tobacco inside. Physicians believed that the heat and stimulation from the smoke could restart breathing and circulation. In some European cities, emergency kits designed for this purpose were placed along busy rivers so rescuers could attempt the treatment immediately after pulling someone from the water. Although the practice eventually disappeared, it shows how creative and sometimes misguided early medical thinking could be. Poisonous substances also occasionally appeared in historical medicine. One example is arsenic, a substance now widely recognized as a dangerous toxin. During the 19th century, however, small amounts of arsenic were sometimes taken as a tonic. Some people believed it could increase energy, stimulate appetite, and even improve skin tone by creating a pale complexion that was fashionable at the time. In certain regions of Europe, small doses were consumed regularly, with users gradually building tolerance to the poison. While some individuals claimed benefits, the long-term effects could be extremely harmful. Leeches were another common medical tool for centuries. These small parasitic creatures, known as leech, attach to the skin and feed on blood. Physicians applied them to areas of the body where inflammation or infection was believed to exist. each leech could draw blood slowly while releasing chemicals that prevented clotting. During the 19th century, the demand for leeches became so large that hospitals sometimes stored thousands of them in jars for regular use. Although the practice later declined, modern surgeons occasionally use carefully bred leeches today to restore blood flow in damaged tissue during reconstructive surgery. Finally, some treatments were based on symbolic ideas rather than direct observation. According to a belief called the doctrine of signatures, natural objects that resembled parts of the human body were thought to possess healing power for those same organs. Walnuts, which resemble the human brain, were believed to help treat mental illnesses or improve memory. Beans shaped like kidneys were recommended for kidney problems, while certain flowers resembling eyes were used for eye diseases. These ideas reflected an attempt to understand nature through patterns and symbolism rather than scientific experimentation.